And here we are with FL31 through 37, occurrence codes and dates. When you first look at this, it looks really overwhelming. Hopefully with every case study that we do, it'll be a little bit more simplified. Again, there's a table to refer to. All we need to do is pull those dates from the case studies that we are referencing. FL31 through 34. These are the occurrence codes that have just one date, so such as an accident or the patient's insurance. So we're just going to have one date for those. For FL35 through 36, this is when it's from a certain time to a certain time, so occurrence span codes and dates. So if a patient had physical therapy for a certain amount of time, we'd put the beginning date and the end date. So hopefully that'll kind of make sense as we go along. FL37, this is unlabeled but sometimes utilized for internal control numbers and document control numbers. For Blanche White, we just have occurrence codes and dates here. This is A1, represents her insurance. This would be her primary insurance, and then the date would be the patient's date of birth. And then B1 represents her secondary insurance and the patient's date of birth. We have room for several more occurrence codes and dates, but for this particular case, we just have these two. So FL32, 33, and 34 would be utilized for the same thing if there are more to implement. FL35, this is our occurrence span codes and dates. As I stated earlier, this is intended for those occurrences that span longer than just one date. So example, if somebody had physical therapy for a certain amount of time, this is the area that we would use it from, and we would put the date that it started and the date that it ended. So FL35, FL36, that's where we would put that. And then FL37 is unlabeled, and as stated, it's sometimes utilized for internal control numbers and document control numbers.